Okay, so this is going to be my sealant tray. We're going to start with our basic, which is the Mouth Mirror, Explorer, cotton pliers. And then you're going to need your slow speed with a straight angle and a bristle brush with pumice without fluoride. Then you're going to be needing isolation devices, which is the cotton rolls, contour angle, the angles. And then bite block just in case the patient's mouth gets tired. You're also going to need your sealant material, which mine is Clean Pro. And then your etchant material. And then your bonding material, which mine is the L-Pop. And then you're also going to need your HVE and your air water syringe. Sometimes you might need an extra micro brush, and then you'll need the articulating paper to check the bite to make sure it's even, and then sometimes you need floss to make sure there's none in the interproximal areas. Okay, so when we're going to be starting the sealants, we are going to take your slow speed and you're going to brush all of the occlusive surfaces with your pumice. We want to clean all of our surfaces, and then after that you will take your and then you're going to get you can either use your air water syringe or cotton rolls to dry the tooth that you're going to be etching, and then you're going to get your dry angle and you're going to pop it in there like that. You get your cotton rolls. You also put it in there, and then normally you put it on the lingual side as well, but with my Typodon it won't stay, so I'm not going to bother. And then you make sure the tooth is continue to stay dry. You place your etch on the pits and fissures. Make sure you cover it well, but not too much. And then you let that sit for 20 seconds. Normally it's easy for you to count down. And then after the 20 seconds, you're going to suck the gob up with your HVE, and then you're going to rinse and continue to suck up in the area for at least another 20 seconds to make sure it's cleaned as well. And then after that, you will dry again for you to be able to put your bonding on. You will pull it out, put your bonding on, thin layer, and then you'll let that sit for a couple seconds, and then you'll put your sealant on, also a thin, even layer to make sure everything is covered, but there's not too much. And then you'll get your light cure and then cure it. That's 20 seconds as well. Then you grab your articulating paper, have your patient bite down, do the whole grinding thing that they do. And then if you see any in them proximal surfaces areas, you will floss. And then you will start to remove after that your isolation devices, but with these angles you have to get them wet before you remove them. So you will spray water on it and then remove. And then you will proceed to the next tooth.